We want to further assure Nigerians that we have strategized along with our development partners on how we can ensure that there's no confusion in the health facilities around which vaccines will be given to whom. So for example, those who have already received the first dose of the AstraZeneca vaccine and are due for their second doses will be given their second doses in this month of August, as we're expecting up to 588,800 doses of the AstraZeneca vaccine from the COVAX facility. This is the first batch that will be coming in the next couple of days. Thereafter, we expect that we will get up to 3.9 million doses of the AstraZeneca vaccines to complement what we already have, and to make sure that we can not only cover those that are expecting their second doses of the vaccine, but also for people who will be taking their first doses, these vaccines will be available. We have made it very clear that the AstraZeneca vaccine, the Moderna vaccines are very effective against the Delta variant that we are beginning to see in states, especially in Lagos and Akwa Ibom. Adopting the whole of family approach to integrate COVID-19 vaccination and other basic primary healthcare services, such as childhood vaccination, screening for hypertension, diabetes, malnutrition, and we will give residents another opportunity to listen to the National Primary Healthcare Development Agency, the State Primary Healthcare Development Agencies, and the State Ministries of Health, how they can improve on personal hygiene, water, and environmental sanitation. This is particularly important in view of the large numbers of morbidity and mortality that we are reporting due to cholera across the country. As I wrap up my speech today, let me once again state that any person who is 18 years and above is eligible to receive the Moderna or any brand of COVID-19 vaccine available in Nigeria. However, it is pertinent to state that mixing one brand of vaccine with another brand is as first and second dose is not allowed. Those who have received AstraZeneca as first dose should take it as the second dose, and those who are taking Moderna as their first dose should take Moderna as their second doses. We will, as earlier informed, be expecting consignments of the AstraZeneca vaccine that can be used for the second doses. Most brands of the COVID-19 vaccines require 2 doses with varying intervals between these doses for full protection. So for example, Moderna is 2 doses 4 weeks apart. The Oxford AstraZeneca is 2 doses with between 6 to 12 weeks apart. And the Pfizer vaccine is 2 doses with 3 weeks apart. However, brands such as the Johnson & Johnson that we're receiving tomorrow is a single dose vaccine that doesn't require a second dose. And for this Johnson & Johnson vaccine, the initial doses are going to be focused on those people that live in hard to reach areas, right? So people that live in riverine areas, mountainous areas, desert areas, any hard to reach community will have residents being given the single shot, just because we know that it's often difficult to get people to take the second shot. We'll also be looking at how we can give the elderly people, because these people also find it difficult to leave their homes and come to the health facility for their shots. So once we get access to them, once we get the opportunity, then we'll give them that single shot. I would like to commend everyone who has already taken the vaccine and thank others who have supported in the cause of the COVID-19 vaccination in Nigeria. One thing that we must do, especially for the over 2 million people who have already taken the vaccine, is to talk to your loved ones. Speak to family members, your friends, your community members, encourage them to also take the vaccine. Because for us to be able to stop this pandemic, we need a critical herd immunity that can only be approached when we reach at least 70% of the eligible population. So it is not just for the public health experts to go out there and try to convince people to take the vaccines, given the information that is available. But since you have taken the vaccine and you have the correct information, then it is also your responsibility as a Nigerian to ask to provide the information to your loved ones, to your community members, and advocate that people should take the vaccine so that we can continue to build the immunity that will ensure that we stop the pandemic and begin to sort of roll back and climb back to our normal ways of living.